I'm Jim Check. You're watching Now Media with me, Kristina Loewen, MLA for Kelowna-Centre. First time with me.
First time.
There you go. And lots to talk about, though.
Yeah.
Lots to talk about. We're going to start with the health crisis that's kind of going on here. This all started with, I think Gavin Dew was in here, and he said some things about what's going on. He spoke to a lot of pediatricians because the pediatric ward has closed in KGH, which obviously caused a lot of community I guess discourse would be a friendly way to say it.
That's a good way to put it, yeah.
And
Concern.
Yeah, a lot of concern. You know, parents having to take their children to Vancouver in that, and obviously that adds more costs and just the level of care. And Kelowna is a major center. It's the second biggest center, I think. Or it is the biggest center outside the Lower Mainland.
Yeah, I believe so.
And it is a regional hospital as well. So you've also been you've been talking with Gavin Dew. You're one of your conservative MLAs here in the Valley here. And then he said he spoke with some of the pediatricians that have left the hospital. Have you as well?
Yeah, so I've been speaking with a number of different physicians, pediatricians, midwives as well, nurses, patients, moms, you name it. It continues to be a really big issue in both of our offices.
We just got an op-ed from Susan Brown. I think it's up live now on Kelowna Now. She says it's mostly related to pay. Is that most of the issues, or is there more issues in that? Because Gavin also outlined, and he brought it up, that's what I think got most of the reaction, a culture of fear that's kind of like permeating IH.
So I haven't heard a ton about pay myself. I've heard a little bit about that, some disparity in pay and I guess unease with contracts. And there's definitely a toxic culture though, and that's what I'm hearing a lot about is a lot of silencing of voices. Nurses cannot speak out, I think, because of the unions and such. Yeah, there's definitely a lot going on, a lot to unpack, and I think it's really multi-layered. But yeah, at the end of the day, it's been going on for a long time, and nobody's been talking about it. And now we finally have this, huge issue bubbling up.
Yeah, the lid kind of blew off the pot.
Yeah,
really, not just a bubble up, but the lid blew off the top because.
That's true.
If you think about back to COVID, where the doctors that did speak out were punished severely, nurses as well, and I've interviewed several of them. And now here we have it where, when I first saw it, the first time I saw anything on it was that young doctor, female doctor on TikTok, I think it was.
Yeah.
I think her first name's Hannah.
That's right, yeah.
And then she kind of said some stuff, and I'm just like, oh no, she's going to get it.
Yeah.
And then I think the next day we got that letter from, I think it was eight doctors, 7 or 8 doctors that supported what she said. So it was tougher now to go after her. Yes. And then right away after that, I think we got another letter that had about 130 signatures on it. So now you couldn't just go after one doctor or the 7 or whatever, but you had them standing together, which makes it really hard and makes it now an issue that is clearly needs to be confronted.
Absolutely. One of the things I loved, I believe it was in the letter signed by the 130 doctors, is they addressed full on that it's not just a global shortage of doctors. There is a toxic culture there and a toxic workplace, and we need to fix that. And we can't fix what we don't acknowledge, right? And that's what's sort of been happening, is this unacknowledgement of a problem.
So Gavin came on with me again the second time, and he's actually calling for Susan Brown's resignation. Do you support Gavin in that?
I do, yeah. I think, Susan Brown's at the very end of her tenure. She's been there a long time, I think over a decade.
I think it's 7 years.
Is it 7 years?
Close to a decade, I guess.
And she's got less than 6 months left, and there's a lack of a plan going forward, other than recruitment and a NICU proposal that's, I'm told, 3 years out. So implementing that. So there's not really much of a plan in the immediate future. We need like a 2-day plan, a 2-week plan, a 2-month plan going forward, and we just keep talking about recruitment. And I think when somebody's retiring, it's best to hang up your head on a high note and say, you know what, hey, I'm going to empower the next person to do this, not try to be fixing a massive fire on the way out the door. I don't think that's in anyone's best interest.
Yeah, Gavin did provide an out, and he said it's not really about whether or not she can fulfill the job for the next 6 months, but a change of leadership will change, I think, put some confidence in some of the doctors that have left, according to him. that they would come back under new leadership and to fix, change that. And, one of the questions I asked them, though, because Susan Brown said she's also seen some of that toxic, understand she's seen it, didn't take much responsibility for it, though, but that she sees it. So the question that comes to me then is, how deep is the rot?
Yeah, I think it's hard to figure out, and I'm certainly not going to blame Susan for all of it. That's not my goal here.
Yeah.
And I don't know how much she is to blame, if she is even at all. But I think just the fact that she's in the end of her tenure, and I think, like you say, fresh leadership would be a good place to start, right?
Yeah. But I mean, the question is that needs to be answered, I think, is how, if Susan Brown doesn't want to take any responsibility for the culture that's there, who is responsible for the culture that's there? Do you know what I mean? Like, how, because the bureaucrats are underneath her too. Like, I mean, there's many layers in the IH, right? And lots of communications people that have a tough time getting any communication. I actually reached out and asked for an interview. So Susan Brown, if you're watching this, I'd love to do an interview with you as well, so that we can talk about this. The community has tons and tons of questions.
We do. And I think, to your question about who's going to take responsibility, I believe in humble servant leadership. And I think that there's a lack of that today, and a lack of, there's no one out there saying, you know what, it's my bad, I messed up. And it would be so refreshing if somebody said that, or even just a hint of that, because I know everybody wants to, not admit guilt and avoid liability, but at the end of the day, we're losing trust, and the public's losing faith in us as, elected officials and bureaucrats and heads of massive companies and provincial arms, and we need to see that, humble responsibility.
Yeah, and then the health minister, Josie Osborne, came out and played that line that we've heard way too much in the last 5 to 10 years, I guess, under NDPs and Liberals, like when something goes bad. Now is not the time for us to try to look to blame others. Now is the time to work together. Well, I mean, at some point you have to start taking responsibility, and because that's the line that the NDP and the Liberal have used tirelessly when they say, oh, we need to work together. But how many times have they asked to work with you when there isn't a crisis?
Yeah, I mean, never.
Never, right, exactly. So you make the big salary, you have the big responsibility. With that comes accountability. So that line is like, most media outlets should not take that line anymore. And I'm going to go back to Tiff Macklin when he said to Canadians, you can rest assured, go out and get that big mortgage. Don't worry about it. We're not going to raise interest rates. And then unprecedentedly, well, this is a realtor, 19-fold increase. Now it's put a lot of people at risk, and he still has his job. And the Liberals at that time says, oh, no, we shouldn't go after him. It's bad to go. It's unpatriotic to go after our institutions. When is accountability happen then? When do we have accountability?
Yeah, and I hope we're starting to see the beginning of accountability right now, because it has gotten so bad, which is, it's unfortunate that it comes to this point. A couple weeks ago I put out on my X a post that just said, two things could have stopped this, right? If they had listened and if they'd taken action. And, for too long, for a decade, people have not been listening.
7 pediatricians resigned in 1 year.
Yeah.
That should be enough for like a 5-alarm, because obviously you, as a CEO, you would have seen that crossing your desk, right?
Absolutely.
Because people would have said, if somebody didn't say anything, there's a problem too, right? But I mean, you would have saw that and you would have said, what's going on here? Like, there's got to be a reason. How do we fix that? How do we convince, like, and this is the part that puzzles me with the health minister, Josie Osborne. We're spending $5 million into the U.S. to recruit, because everything gets politicized for them. They think everybody hates Donald Trump, that they're going to come up here for half the wages and double the taxation because they hate Donald Trump. Why don't we spend that money or effort here and get the doctors that won't work in the hospital to come back to work? Wouldn't that be a better spend?
Oh, I think so, yeah. And we were going to spend it, and what are we going to get for it, right? There's no guarantees either that people want to come here.
Well, maybe you can help us, because they did the advertising in the UK about, I can't remember, close to a year ago, and for doctors. We asked how much they spent and how many doctors they got. They say they don't have that information. And we put out an FOI, I think it's got to be 6-7 weeks now, and still no response.
Yeah, I'd be very interested in knowing that answer too.
How do we get those answers? Where's the accountability? Like, it should be an easy answer, because somebody wrote a check. Somebody wrote a check for X to the UK advertising agency or wherever they spent it, and then they would have got a doctor or not a doctor.
Yeah.
I think that was a TV show, Doctor, Not a Doctor. Yeah, we should look into that. What are you hearing, though, from some of the doctors that you've talked to? Like, what would it take to get them back in the fold?
Yeah, so I haven't heard specifics yet on what I think we're coming out with some things. I can't speak about it yet in the coming days as to what it would take. But we're working on that. As far as, some of the issues that we have, we were just talking about how this puts pressure on so many other, yes, the pediatric unit is closed, but what's happening in the emergency department now, right? When sick kids come in, there's more pressure on the emergency department as well. And there's more pressure potentially on the NICU and the maternity because they don't have pediatricians necessarily in the hospital to consult with. Certainly in the ER, we're hearing that. So, we've got to protect the whole institution and make sure that we don't see more cracks going forward. That's a big thing. And I think that's kind of top of mind right now for us as politicians, official opposition. We want to get some eyes on the ground here and get a plan moving forward.
Can we switch gears?
Mm-hmm, for sure.
Can we switch gears to I think this is going to be the biggest scandal for the BC NDP this year for sure, and that's the BC ferries.
Yes.
And I think it's a liberal NDP thing because we hear from, and I think Rob Shaw came out and called David Eby Captain Canada, whereas the Cape. But then when it comes time to invest in British Columbia, the investment went overseas to the CCP. And I think before we started, you said that the Prime Minister Mark Carney had outlined that the CCP is the greatest threat to Canada.
Yeah, he said that during, I think, the election. Yeah.
And then Melanie Joly continues to say she's our jobs and innovation. I think she says a couple of things. The economy is her thing. And she says we will build all infrastructure projects with Canadian steel and Canadian aluminum. I think those ships are built out of those things. And then there is pressure on the Liberals to put pressure on the BC government. And then Transport Canada's minister, Chrystia Freeland, has said that she doesn't really have control over that because it's part of their operational. She only gives money for the operational budget, not for the capital budget, which seems very weak. And then Farnsworth, I think, had said that like the BC Ferries, it's an independent organization, but it's a board appointed by the NDP.
Right. Yeah.
So not very independent.
Yeah, not very independent. Yeah, that's a can of worms. I think it's a big scandal as well. Not only did they take taxpayer money at the federal level and give it to the BC NDP to get a shipbuilding contract, they took it and gave it directly to a state-owned Chinese company.
Basically everything in China is state-owned.
Yeah, right? So straight directly into the Communist Party's hands. And
to build ships.
Yeah, to build ships. And they could have gone to potentially one of our allies, like France or Japan, maybe.
Or Canada.
Yeah. And instead, we are, not providing any BC jobs or Canadian jobs even. And we're giving it to a state that's hostile towards us, that kidnaps Canadians, that tariffs us at 100% on our canola and other products.
Yeah, that was a big punch in the face for old Scott Moe when we're supposed to work together, one economy. Yeah. And here's canola tariff still there, and then we give that contract. And then C-SPAN came out with a statement as well. C-SPAN saying that we can't compete on price with China because they use unfair labor that there's lots of issues with. They have cheap labor, and then a bunch of unfair trade practices that they can't compete with. Why wouldn't we invest in Canadian jobs that help Canadians, especially British Columbians? Like, we could use that in this economy.
Absolutely, yeah. Well,
I think John Rustad is on that.
Yeah, he is.
He's beating that drum, and I don't think that one is going to go away for the NDP.
Yeah, I think it's a big problem. Some of our staff members went out to a party later on that evening when they got that contract and saw them celebrating the contract.
Imagine they were celebrating it. Yeah. What were they celebrating? Giving away BC jobs?
I think so, yeah. They were able to see, how much they were spending on the taxpayers' dime again, and yeah, good timing on that one. Took some photos, put it on X, so you can find that.
Yeah, I know, I saw it. I saw it. So I don't think that's going to go away.
No.
What other pressure can the Conservatives put on the BC NDP for that?
Well, I think that they're experiencing a lot of pressure from us already. We're going to continue to talk about it, and you can't keep saying buy local, buy BC, and keep tuning that horn, I guess, and then going and doing the opposite. I mean, that's the definition of hypocrisy, isn't it?
It is very disheartening to see the Premier stand up and talk about buy BC, spend in BC, don't buy liquor from the U.S., don't go to the U.S. And I mean, he's probably had the highest amount of rhetoric other than Doug Ford on Trump and the Americans, and here we give it away to China. Wow. Yeah. Doug Ford has been pleading and getting no response really from the Liberals or support from BC on the canola tariffs, and Daniel Smith, to bring that into the fold, asking for that, access to the pipeline, the Northern Gateway pipeline, and basically getting a no from David Eby as well.
Just a slam door, yeah.
Yeah. Well, you and I both attended the Chamber event.
Yes.
And maybe we'll end with that, and won't go too far with you this first time here. But the Chamber event there, Brenda Bailey, the finance minister, spoke at that event. And I wasn't a big fan of the format because there was no challenging on her responses. It was basically just talking points. How did you find that event?
Yeah, I found it felt like question period, actually. I felt like the questions themselves were a little bit adversarial towards her, and I think rightfully so. I think you have a room full of business owners and people who have been harmed by NDP policy over the last few years, and they want answers and they want accountability. So they're asking some tough questions and things that weren't in line with her belief system, I guess. And she took a little bit of an adversarial approach, which I was surprised by for a politician. We're supposed to be kind of good at smoothing things out and talking our way around. I was surprised that she took I'm too authentic and new for that. But she took a little bit of an adversarial approach, which surprised me. And I thought that, one of her answers in particular was a bit of a problem in regards to the short-term rentals. She said, well, we need to build more hotels. And I thought that was a huge slap in the face to a lot of really small business owners in there who own probably one unit or did at one time.
Well, I did the interview with the head of Airbnb Canada. 90% of the Airbnb owners in Canada own one unit.
90%, wow.
90%. That's from Airbnb, and I asked Airbnb if they were allowed to contribute to the study that the NDP used to put this legislation forward, and that was a hard no. But they did use the study that was funded by the BC Hotel Association.
Problematic.
I asked David Eby personally in an interview if they considered that to be biased, and he said no.
Yeah, that's conflict of interest 101, right?
I would have said it was definitely biased. I'm a CPA, and I would have flagged that right away. I would have wrote that down, and I would have said there's a problem with this. It's a perceived conflict there, isn't it?
I agree with you.
If it's
100%.
not 100% conflict, I don't know. It's somewhere in there. And some of the questions should have been challenged more for sure. And they talked about forestry as well, and I've done so many stories on forestry and interviewed so many people in the forestry sector, including Kofi, one of the executives from AP Planers that closed the mill in Merritt, and John Rustad. I interviewed him several times on it, and he said forestry was in shambles. So did Kevin Falcon. And this was long before Trump, and then the forestry was brought up because I brought it up in there, and the only answer we got was Trump did it. Well, Trump wasn't there. Forestry has been in shambles far before Trump showed up.
Yeah. No, the same answer we get in the Legislative Assembly. That's why it reminded me of question period. Everything's Trump's fault.
Yeah, the Trump card. You just pull it out, right? Just like, oh, there's the answer. Trump.
Trump card.
Trump. Trump. And, it's funny to watch the Liberals in the campaign. They won the election playing the Trump card, the elbows up thing, and then looking at their reaction, like I watched it today, it's completely not elbows up anymore.
Yeah, right? Yeah, exactly.
Anyway. Anything else you want to cover off today?
Nothing on my mind right now.
Nothing. There you go.
A lot going on though.
Thank you for coming in, and we hope to have you more often. See, that was easy.
I think it was easy. Yeah, you were easy on me, Jim.
And then again, we'd love to have Susan Brown in, and Brenda Bailey's promised me an interview.
Oh, good.
So I've interviewed her in the past, and it went well.
Oh, good. And, not adversarial.
No.
Good.
And asked some questions, and I also got to interview. They all want to talk when it's election time. Nobody wants to talk after the election, though, right? You know what I mean?
I do.
Thank you for coming in. And we do thank you for watching Now Media, and hope you like and share. And if you got any ideas and comments on that, we appreciate those as well. And thank you to Kristina Loewen, MLA for Kelowna-Centre.
We don't just report the news, we live here too. We're your neighbors, bringing you stories that matter to all of us. No government funding, no outside influence. Kelowna Now, local, independent. News you can trust.